Hi, I'm Dr. Renee Azar, and I'm going to talk about risks of surgery today. Any surgery that we do has associated risks. These are general lists, actually. I'm going to go over things that are known to be potential risks of any surgery, any procedure, and we'll go over them just in general, but also as it pertains to the surgeries that I do, which are pelvic floor or gynecologic specialty surgeries. Firstly, any surgery will put you at risk for infection. Infection occurs because we are breaching the body's natural immune barriers, and therefore bacteria from the environment or from other parts of the body can get into the areas that are exposed. And that's why procedures put you at risk for infection. Also, there are risks for bleeding. Obviously, we cut across blood vessels. And if you bleed excessively, you could possibly require a transfusion. Transfusions are blood products. Receiving blood products can sometimes mean you're getting red blood cells, or sometimes you'll get proteins that can help you to clot off and stop bleeding so much. Anytime you have a transfusion, there's going to be risks for virally transmitted diseases like HIV, hepatitis, and these risks are pretty minimal these days when we have good screening. As a matter of fact, for packed red blood cells, the risk of HIV is in 1 in a million. For risk of hepatitis B transmission, it's 1 in 60,000. So transfusion-related risks are pretty minimal, but we like people to be aware of all risks. In addition to those two previous potential complications, surgery puts you at risk for damage to other tissue or organs. We're in the body. We're using instrumentation. We're trying to find our way around. We're trying to get to certain parts of the body. Unfortunately, in the course of that, it is possible to have damage to other tissue or organs, possibly requiring further hospitalization, surgery, or even death. We minimize these risks by knowing the anatomy, by being aware if the patient has had previous surgeries. It is very important that your surgeon knows if you've had surgery in the area of their surgery before, because people can have scar tissue. Previous surgeries can put organs or blood vessels or other important parts of the body in a different position than we're used to. So you can keep your doctor aware of prior surgeries and or complications that you've had, and that will help us to avoid risk of damage to other tissue or organs. There's a risk of blood clots. Some of that has to do with the nature of surgery, medications received, but also because people are more sedentary. And blood clots, of course, usually most problematically occur in the lower extremities, the legs, and they can be thrown to important parts of the body. Most problematic is the pulmonary embolism blood clots, the blood clots that are thrown to your lungs. We have excellent prevention measures with those, sometimes using blood thinning agents. We also use stockings, compression stockings, and what we call pneumatic compression stockings. So when you're in the hospital, you should always have, when you're at rest for more than an hour or two, you should have pneumatic compression stockings on your legs that are constantly pumping on and off, alternating between resting and pumping phases to keep the blood flow there and prevent blood clots. In addition to blood clots, other events can occur such as heart attacks or strokes. Having surgery is a stressor to the body, and those can be risks that are associated with surgery as well. That's why we oftentimes get cardiac clearance or clearance from a doctor that might be prescribing blood thinners to you. Anesthesia-related risks can include aspiration, where you breathe in some of the contents from your mouth, which is a lot of bacteria. We'll go over that again in the future. There's a hereditary condition called malignant hyperthermia, where people can die from a high fever and associated complications related to a hereditary reaction to anesthesia agents. Surgery, of course, is also putting you at risk for, predictably, short-term and sometimes even long-term pain. Short-term pain occurs after most surgeries. We do our best to provide excellent pain coverage, and it's helpful if somebody has a significant surgery that they're in the hospital, and we have a pharmacy right there so that we can obtain various agents and figure out what works best for you. Long-term pain can occur after surgeries because people can get scar tissue or have abnormalities in their healing process that can lead to chronic pain. During surgery, materials are used. sometimes other animals' body parts, sometimes people's body parts, sometimes sutures can get infected or rejected from the body. And your doctor, and myself included for your surgeries with me, will keep a close eye out for those things, and both during the immediate time period, but also kind of remotely, so we can make sure that if you have a problem like that, we can address it as early on as possible. During the surgeries that I do that relate to pelvic floor reconstruction, I like people to be aware that it's a long surgery oftentimes, and so sore throat is something that we'll see as a problem post-operatively. Lozenges are good for that. You can get them at the hospital or bring them in with you. Because of the nature of what I do, which is taking care of bladders that do not behave themselves, oftentimes bladders that have been repositioned and manipulated during the surgeries that I do will have some retention. Urinary retention is not uncommon. Oftentimes, I can even predict that somebody's going to be at very, very high risk for very, very significant urinary retention. What does that mean? That means I may even send you home with a catheter because I predict that your bladder needs the rest or is at high risk for having a prolonged course of using a catheter intermittently before their bladder wakes up. So urinary retention is not uncommon, and people should not be frustrated with that. The bladder is like any other organ. If you have hip surgery, you don't go run a mile. If you have a bladder surgery, sometimes we have to relax and let the bladder rest. And the only way to do that is with a catheter to deflate the bladder and let it rest. I also do that to prevent adhesions from reforming in some of the surgeries where I've gotten into somebody and who's had a previous surgery that failed, and I have to take some adhesions down, and I don't want them to recur and cause problems with bladder function. Frequent urinary tract infections are relatively common post-operatively in the first 3 to 12 months after surgery. And sometimes I'll end up giving people preventative antibiotics or preventative medications to keep them from having recurrent urinary tract infections. It has to do with the immune compromise that comes after surgery. I'm going to refer to this process again, but when I do surgery in the pelvic floor area, I am taking away the surface tissues, and that will undermine and will sometimes cause some difficulty with the blood vessels getting to that area for a while after surgery. As they grow back, I basically devascularize certain parts of the body to get in there and fix things and put them back into their normal position. So in that process of the body healing and the blood vessels getting back to that area, you can be at higher risk for infection. And one of those infections is going to be urinary tract infections. We'll talk a little bit more about that in a few minutes here. Depression. Depression is a stressor for the body. Depression is a stressor for the brain. You can get depression after surgery, or you can get worsening depression after surgery. I look for it before surgery. If I see it, I like to address it because not being depressed is something that can help you in the healing process. So if you feel like you're having some depression, please bring that to my attention. C. difficile is used to be an unusual infection because it was a less common bacteria, but in the last 5 years, C. difficile as an infection in the bowel has become much more common. More and more people are what we call colonized or carry that bacteria. And because at the time of surgery, we give a lot of antibiotics to prevent other types of infection, the bad C. difficile bacteria that inhabits some people's bowels can take over and cause a lot of diarrhea, sometimes fevers and bloating as well. So if somebody has diarrhea post-operatively, we like to get testing for C. difficile quickly. People can get stitch erosion. So sometimes after surgeries, the stitches that I use can work their way up to the surface. Usually it's just a process of clipping the stitch and it will heal over. However, if the stitch has been eroded for a long time and the person has maybe had symptoms and didn't come in right away, bleeding, abnormal discharge, then sometimes it can get infected and I'll have to go in and take an infection out and clean it out. People can have other complications like aspiration pneumonia a little more frequently after pelvic floor surgeries, and that's because during that surgery, people are lying down and their head is usually a little bit downward inclined. And so that makes it a little more likely for them to have some of the contents of their mouth kind of be coughed back up into their lungs as they're waking up and sitting up. That can give something called aspiration pneumonia. Usually it will show itself within a day or two, and we catch it in the hospital, we give you antibiotics, generally the same ones I send you home with anyway after surgery, and we can keep that from being a big problem for people. In addition to that, people who have surgery are going to have other infections that are less common, such as you can get infections in the perineal area, and that's, of course, not something that you're going to see in most infections. So it is a difficult area to keep clean. I do like people to buy a soap called HibiCleanse, H-I-B-I, Cleanse, C-L-E-A-N-S-E, and it is a soap that helps to keep the area in the female parts clean upon contact. So it doesn't have to be there for a long time. You can just get some sudsy material, put it on your hands, wash up down there, and get in the shower. I prefer a bathtub, but some people have difficulty getting in and out of the bathtub, so we do a shower to help prevent infection. And one other thing I'd like to talk about in the context of vaginal health is that after, once again, I have devascularized that area, it is really, really important that people use hormone replacement therapy in the vagina. And that gets absorbed locally. It does not get absorbed very well from your system. So pills, patches, shots do not do much for the vaginal health. But the vaginal tissue loves estrogen, and with estrogen in the local area, there's not an increased risk for breast cancer or blood clots. We have lots of data to uphold that. But we like people perioperatively, really prefer for them to use it preoperatively as well as postoperatively. I'll usually start at 2 to 3 weeks after surgery. And that is, have you do a vaginally applied estrogen cream. And what that will do, or another product, cream, a suppository, a capsule, those products are products that give some estrogen stimulation to the vaginal tissue, which increases blood flow, increases glandular secretions, making that tissue more moist, more healthy, faster healing, better immune system. So that's an overview of risks associated with any surgery and a little bit of extra discussion regarding risks that are associated with pelvic floor reconstructive surgeries. Thank you.